7 senior heart hacks that could save your life. I'm a cardiologist and I've treated thousands of patients. So often I see people in my office after a heart event who thought they were doing everything right. They'll tell me, "But doc, I eat salads and I walk every day." The truth is, some of the biggest threats to your heart after 60 are the ones nobody talks about. These aren't the same old tips you've heard 1,000 times. These are the secrets that could genuinely save your life. Stay with me because I'm about to share 7 of them. Heart hack number 1, the silent symptom emergency plan. All right, let's jump into our first life-saving secret. We all think we know what a heart attack looks like from the movies, that crushing chest pain, right? But for seniors, the reality is often dangerously different. Many older adults experience what we call atypical symptoms. This could be a sudden extreme wave of fatigue, shortness of breath without any chest pain, nausea, or even just a strange feeling of confusion. I'll never forget my patient Eleanor, who was 78. She called her daughter one afternoon saying she suddenly felt too exhausted to even get off the couch. She just figured she was getting old. Thankfully, her daughter suspected it was something more and called for help. That overwhelming fatigue was her heart's only major signal that it was in serious trouble. She was having a massive heart attack. So, heart hack number 1 is creating a silent symptom emergency plan. First, you have to recognize that for you, a heart attack might not be chest pain. It might feel like profound weakness, sudden breathlessness, or even pain in your jaw or back. Second, and this is the key part of the plan, if you live alone and experience these symptoms, the very first thing you do after calling 911 is walk to your front door and unlock it. Why is this so important? Because every single second counts. Paramedics can lose precious minutes trying to force their way into a locked house. Unlocking that door gives them the fastest possible path to start saving your life. It's a tiny action that can be the difference between a full recovery and a tragic outcome. Please don't just dismiss unusual fatigue or shortness of breath as a normal part of aging. Treat it with the seriousness it deserves. Heart hack number 2, the aspirin chewing trick. Moving on to hack number 2, and this could be one of the most important things you learn today. Most people have heard you should take an aspirin if you think you're having a heart attack, but how you take it makes a world of difference. A common mistake is just swallowing the tablet with water. People think, okay, I've taken the aspirin, I've done my part. But in a cardiac emergency, that's the slow route. I had a patient, George, 68, who did exactly that. He felt the classic chest pressure, calmly went to his medicine cabinet, and swallowed an aspirin. By the time paramedics arrived, the aspirin had barely started to work. This brings us to heart hack number 2, the aspirin chewing trick. If you suspect a heart attack, you need to chew a 325 milligram non-enteric coated aspirin. Don't just swallow it whole. Chew it for 30 seconds before you swallow. Here's the science. Chewing the aspirin starts the absorption process right there in your mouth. Studies have shown this is the most effective way to get aspirin into your bloodstream quickly. Its anti-clotting effect can begin in as little as 5 minutes when chewed, compared to much longer for a swallowed pill. In a heart attack, those minutes are heart muscle. Chewing aspirin is the fastest way to get its life-saving properties working to break up the clot that's starving your heart of blood. Keep aspirin handy, and if you ever need it, remember, chew, don't just swallow. Heart hack number 3, the forgotten fitness component. Everyone knows that cardio, walking, swimming, biking, is good for your heart. It's been preached for decades. But this singular focus has created a dangerous myth that cardio is all you need. This leads so many seniors to neglect what might be the most important type of exercise for their long-term health. I think of my patient Maria, a dedicated 75-year-old walker. She walked 2 miles every single day, rain or shine, but she was becoming increasingly frail. One day, a simple trip over a rug led to a bad fall and a broken hip, a catastrophic event for her health. While her heart's plumbing was in decent shape from all the walking, she had no muscular strength to catch herself or to endure the tough recovery. So, heart hack number 3 is to embrace the forgotten fitness component, resistance training. Now, this isn't about becoming a bodybuilder. It's simply about working your muscles against some kind of force. You can do this with light weights, resistance bands, or even just your own body weight with exercises like chair squats and wall push-ups. Why is this a hack? Because while cardio is great, resistance training offers unique benefits that are critical for seniors. It builds and maintains muscle mass, which is vital for stability and preventing those devastating falls. Stronger muscles also help improve your metabolism and how your body uses insulin, reducing major risk factors for heart disease. In fact, research shows that resistance training directly benefits heart health by helping to lower blood pressure and improve circulation. Your goal shouldn't just be to walk far, it should be to have the strength to easily get up from a chair, carry your own groceries, and live independently. Don't let your muscles waste away. Heart hack number 4, the vaccination shield. This next hack is one that surprises almost all of my patients. When you think about protecting your heart, you think diet, exercise, cholesterol. You probably don't think about getting a shot in the arm. But this is one of the most powerful, overlooked secrets for defending your heart as you age. The problem is, we tend to see infections like the flu or pneumonia as totally separate from heart health. A patient of mine, Frank, 81, was managing his heart condition beautifully. He was stable, active, but he skipped his flu shot one year and caught a bad case of influenza. The infection put immense strain on his body. The inflammation it caused destabilized the plaque in his arteries, and he ended up in my hospital with a major heart attack. His heart just couldn't handle the stress of the illness. This leads us to heart hack number 4, the vaccination shield. Staying up to date on your recommended vaccines, specifically for influenza, COVID-19, RSV, and pneumonia, is a critical part of your heart health routine. Here's why this is a life-saving hack. These respiratory infections cause massive inflammation throughout your body. This inflammation can directly trigger a cardiovascular event. Studies have shown that the risk of having a heart attack can be 6 times higher in the week after a confirmed flu infection. Getting your annual flu shot can reduce the risk of a heart-related event by nearly 20%, or even more in high-risk adults. Think of these illnesses as a major stress test for your heart. A vaccine is like a shield that prevents your heart from ever having to take that dangerous test. It is one of the simplest, most effective things you can do to prevent a trip to the hospital. If you're finding this information valuable, and I really hope you are, do me a quick favor and click that subscribe button and the little notification bell. My goal is to get this life-saving information to as many people as possible, and your support helps make that happen. Heart hack number 5, the anxiety versus attack litmus test. Our 5th hack deals with a symptom that's as mental as it is physical, and because of that, it's tragically easy to dismiss. It's that feeling of impending doom. Many people, especially those who already deal with anxiety, might feel a sudden wave of intense unease or a sense that something terrible is about to happen and just brush it off as my nerves acting up. I treated a woman named Carol, 67, who had suffered from panic attacks for years. One evening, while watching TV, she was gripped by a sudden, intense feeling of dread. It felt different from her usual panic attacks, more profound, but she tried to use her breathing exercises, assuming it was just a bad one. She waited 2 hours before her other symptoms became too severe to ignore. Those 2 hours cost her a significant amount of heart muscle. So, heart hack number 5 is the anxiety versus attack litmus test. You must learn to take a sudden, unexplained feeling of impending doom seriously, as it can be your body's primal scream for help before a major cardiac event. So what's the test? While a panic attack often builds with racing thoughts and may have a trigger, the sense of doom with a heart attack can feel like it comes out of nowhere. It's often accompanied by other subtle physical symptoms like sudden sweating, shortness of breath, or nausea. The hack is this: if you experience a sudden, overwhelming sense of doom and it feels at all different from your typical anxiety, or if it comes with any new physical symptom, no matter how small, you do not wait. You call 911 immediately. Doctors take this symptom very seriously for a reason. It is always better to have a false alarm than to explain away a true emergency until it's too late. Heart hack number 6, the heart-healthy sleep position. We all know sleep is important. You've heard the advice to get 7 to 9 hours a night, but just like with exercise, the details of how you sleep really matter, especially for seniors. Many people are sleeping in a position that could be putting a strain on their heart night after night. A patient of mine with mild heart failure kept complaining about waking up tired and breathless. We checked everything, his meds, his diet. It turned out the problem was how he slept. He was a devout back sleeper on a single flat pillow. For someone with a weakening heart, this position was allowing fluid to settle in his lungs overnight, making it harder to breathe and forcing his heart to work harder. This is heart hack number 6. Find your heart-healthy sleep position. For many people, sleeping on your left side can be a great choice because it may help with circulation and reduce acid reflux. However, for some people with existing heart conditions, sleeping on the right side might actually feel more comfortable. And here's the most important part. For anyone with heart failure who gets breathless at night, sleeping propped up on a few pillows or a wedge is often the best thing you can do. This uses gravity to keep fluid from congesting your lungs, taking a major load off your heart. The right position can be different for different people, so talk to your doctor. The goal is to find what helps you reduce the nightly strain on your most vital organ. Heart hack number 7, the sodium swapping secret. Our final hack tackles one of the biggest enemies of senior heart health, sodium. Everyone tells you to eat less salt, but that advice is vague and honestly hard to follow. It feels like a punishment, forcing you to eat bland, tasteless food. The result? Most people just don't stick with it. The problem isn't a lack of willpower, it's a lack of a good strategy. I see patients all the time whose blood pressure stays stubbornly high. They swear they've cut back on salt, but what they've really done is remove flavor from their life, making the diet impossible to sustain. Eventually, they go back to their old habits because the alternative is just too grim. This is where heart hack number 7 comes in, the sodium swapping secret. The goal isn't to remove flavor, it's to replace it. This hack is about actively swapping salt for other powerful, delicious flavor agents. Instead of reaching for the salt shaker, I want you to build a new habit. Reach for garlic powder, onion powder, smoked paprika, or chili powder. Squeeze fresh lemon or lime juice over your vegetables and fish. Use fresh herbs like dill, parsley, and basil. These ingredients add a huge punch of flavor without a single milligram of sodium. The why is simple. High sodium leads to high blood pressure, a primary driver of heart attacks and strokes. By swapping salt for these other flavorings, you reduce your sodium intake effortlessly without sacrificing the joy of food. This makes it a habit you can actually stick with. Your taste buds will adapt surprisingly quickly, and your heart and blood pressure will thank you for it. So there you have it, 7 secrets that go beyond the tired old advice. Let's do a quick recap. 1. Have a silent symptom plan and unlock your door. 2. Chew, don't just swallow your aspirin. 3. Embrace resistance training for real-world strength. 4. Use vaccines as a powerful shield for your heart. 5. Trust that gut feeling with the anxiety versus attack test. 6. Optimize your sleep position to ease your heart's workload. And 7. Swap sodium for delicious, powerful flavors. Your heart has an incredible ability to heal. It's never too late. By bringing even one of these habits into your life, you are taking a powerful step towards a longer, healthier, and more vibrant future. You are taking back control. I have a question for you, and I'd love for you to answer it in the comments below. Which one of these hacks are you going to try first? Sharing your commitment is a powerful first step. And for more life-saving advice from a cardiologist who truly cares, make sure to subscribe and click that notification bell. Thanks for watching.